Welcome to this introduction of AmeriPlan health programs. My name is Debbie Carroll, a National Sales Director with AmeriPlan. With my background as a registered nurse, I saw firsthand the need in the marketplace for affordable services for American families. I will be your host through this series of trainings to give you a better understanding of AmeriPlan and the services they offer. Make sure you have a pen and paper handy and take some good notes. The purpose of these training modules is to give you a basic understanding of the dental and medical benefit programs that are offered to our clients and how they work. At the end of these training sessions, you'll learn more about the company and the industry, the benefits we offer, and how the service works. We'll show you step by step how to process applications and access your support and marketing website. You'll have a better understanding of our target markets and learn some successful marketing strategies. Lastly, we will address retention strategies so you can keep those long-term residuals coming in. Our goal is to give you a good understanding of all the programs so you'll be more effective in marketing the service. The healthcare industry in the United States is in the midst of a crisis of epidemic proportions. The cost of healthcare has been increasing at double-digit rates for the last several decades. Instead of advocating lower costs, the insurance industry is merely increasing the rates to cover the skyrocketing cost of care. The result, more money for the providers and insurers, but a disaster for healthcare consumers, whether it's an individual or an employer and their budgets. The current system leaves 47 million Americans without insurance, 31 million are underinsured, and 62% of all employees work for small businesses who are no longer offering coverage, and the numbers are increasing daily. CBS News recently reported that over 100 million people are without dental benefits. In response to this crisis, a different type of health care is driving to the forefront, consumer-driven health care. This is a system that puts the healthcare relationship back into the hands of the provider and the consumer while removing or diminishing third parties. This system allows a better delivery of healthcare and at the same time significantly decreasing its cost. As with many new and exciting concepts, consumer-driven healthcare programs are springing up everywhere. Some of them are credible and some of them are not. Due to this situation, many legislators, regulators, and other consumer advocacy groups have begun to scrutinize these types of plans in the interest of protecting the unwary consumer against the possibility of fraud and misrepresentation. AmeriPlan is committed to the best possible service for our clients, and your understanding of how these programs work and what they will do for our clients. These training modules will help you understand more about the programs we market. We truly have a great service to market that's helping a lot of people every day. I'll tell you, I've researched all the other plans similar to AmeriPlan that are being offered out there, and there's no doubt we are the best. Most of the other plans don't give you the savings we do. Usually they only offer discounts of 25 to 50%, and not only are their list of dental providers considerably smaller, but they don't have direct contacts with them, which facilitates a better relationship, so bigger discounts can be negotiated. And some of them have an enrollment fees as high as even $100, even for a small dental plan. We are the best, and you can be very proud of that fact when talking to others about AmeriPlan benefits. You'll find that our plans are really simple, and they're not that complicated at all. Let me start off by telling you a little bit about why doctors and dentists would want to be providers for us and give our members discounts. First and foremost is putting the decision-making process about the patient's care out of the insurance company's hand and back into the hands of the physician and the patient. If you were to go to your dentist right now, and let's say you were on a good insurance plan, the dentist is automatically going to give the insurance company a discount. It's a sad fact that only the uninsured individuals ever pays full price. Insurance companies are only going to pay the dentist about 70% or less of the regular price. In addition to that, the dentist has to hire somebody for the office, put them on payroll, give them office space just to work with the insurance companies and file claims, so the additional salary and overhead now costs them 40% of the 70%, which actually means they're only going to make about 48 cents on the dollar, and they're going to actually have to wait 9 to 12 weeks to get paid from the insurance company on the claim. What dentists want is a simpler system to process and quicker cash flow. By passing these discounts on to our members, they get paid immediately and everyone saves. Not too long ago, D Magazine, which is a Dallas-based magazine printed a list of the top 100 dentists in Dallas, and this wasn't a list where they had to come up with, but was compiled by dentists ranking each other, peer ranking. 13 of the top 100 dentists in Dallas are AmeriPlan providers, and 9 of them have been so far for over 10 years. That shows how much dentists like being providers as part of our program, and it also shows the kind of quality care that our members are receiving. It's truly a win-win situation for everybody. It's important for you to understand that AmeriPlan benefits are not insurance. They are fee-for-service products that enable consumers to purchase healthcare services from providers at discounted prices, similar to the rates that healthcare providers charge wholesale consumers, such as preferred provider networks, which are PPOs, or larger insurance plans. Many consumers choose AmeriPlan to complement their health insurance plan, filling gaps such as prescription drug benefits, chiropractic, dental, or vision care, which are often not included as part of their insurance plan. AmeriPlan has gained popularity because they provide consumers with low-cost access to health care they need and the opportunity for savings that greatly exceeds the cost of the program. With the flexibility of monthly membership, in addition, the plan covers the member's entire household. Now, when we're talking to people, we don't want them thinking that we're insurance. What you do want to say is that the great part about our company is that we're not insurance, so we're really better in some ways than insurance. And we don't have all the stipulations that come with insurance. We don't have exclusions for pre-existing conditions. There are no copays, no waiting periods, and most insurance plans, that most insurance plans have. We can actually cover everybody in the household, related or not, college students, mother-in-laws, just friends that happen to be staying with you, and you can use it right away, so we share the positive side about not being insurance. Now, a little bit about the company and the history of the industry. AmeriPlan was actually started in 1992, and the company pioneered the concept of a dental plan in the United States. Back then, you didn't hear about a discount fee for service, as it really was a fairly brand new concept. Today, 80% of dental clients who have some sort of coverage are now covered by a discount plan rather than insurance. We are recognized by the American Dental Association. They had our VP of Provider Relations out to be a keynote speaker for 2 years in a row to share where the future of dental care is going. Our company is a Dun & Bradstreet listed, and we're debt-free. We are members in good standing of the Consumer Health Alliance, the National Association of Dental Plans, the United States Chamber of Commerce, and the Direct Selling Association. A few years ago, AmeriPlan saw the need for a good health plan and wanted to develop a solid program. They had an excellent reputation with their dental plans, and they wanted to make sure they maintained it. In 2002, the Consumer Health Alliance was established to educate consumers and regulators about the benefits of discount healthcare programs, promote fair and ethical business practices, and to work with state legislators and regulators to ensure that regulation of the industry protects consumer rights to access affordable healthcare services and products. Dennis and Daniel Bloom, the founders of AmeriPlan, took a proactive role to work with the Consumer Health Alliance and make sure that AmeriPlan met the high standards established by the Consumer Health Alliance. In order to launch this nationwide, AmeriPlan contracted with a PPO network, which is an organization that contracts with providers to provide services in each state. As we work to build our own provider network in the healthcare side of our company, we are phasing out the need for the leased network. AmeriPlan is working diligently to contract with physicians and other ancillary providers nationwide. Every week, contracts are signed with over 100 new providers nationwide, and that number is consistently growing. AmeriPlan is positioned to be a leader in the consumer health care driven industry.